While it's important to treat symptoms, it's critically important to go upstream to the cause.
You said a couple of things that really fascinated me. Today, we're going to look at all of the various case studies that illuminate why hypnosis can be so helpful for people. Most people seek what's known as allopathic solutions. Allopathic, which is basically the way the United States practices medicine, by and large. Allopathic means treat the symptom, not the cause. It also kind of conditions us, I think, and I want your opinion, obviously, to think, I got a headache, I'm just going to take some aspirin and move on. And most of the time, yeah, that's fine. But sometimes when we don't look for the cause, we can just have that recur.
There's something called the parable of the river. In a far off land, there was a river and a village on the side of the river. And there were some people, just picnicking or something on the side of the river. And they noticed that a baby was just sort of floating down the river towards a waterfall. And these people were very alarmed, and they went back to the village. And, after a few more sightings of more babies, one at a time floating down the river to their doom, they gathered the elders of the village together, and they said, what are we going to do? We have to save these babies. We have to, prevent them from going over the waterfall. And so they all agreed that they would set up watchtowers to see the babies coming from a little farther upstream, so they'd have time to go and, go in and rescue them with rafts and swimmers and divers and all these things. And they set up all this whole apparatus to prevent the babies from falling over the waterfall. And so it became like the main focus of the village. And while at first this was successful, over time, more and more babies were floating down the river. And it became almost too many for the people of the village to handle. More watchtowers, more divers, more swimmers. Pretty soon there were dozens of babies at any given time going down the river. And someone said, wait a second, why don't we go upstream and figure out how these babies are ending up in the river to begin with? And the village elders said, no, don't be foolish. If we do that, we won't have anyone here downstream to stop them from going over the waterfall. So when I've told that story before to illustrate, in a way, the absurdity of our sick care system, and I mean that in mental health as well as the physical allopathic approach. And so while it's important to treat symptoms, it's critically important to go upstream and figure out who's dropping these babies in the river to begin with, and go upstream to the cause. I used to be a nutritionist 20-something years ago, and so I learned all about this from the dietary point of view. But even people who are overweight because they're eating too much or eating poorly and not moving enough, and usually that's the cause, that is usually caused by something emotional. And that emotion is usually caused by something the person is thinking. And that thought pattern, whether it's mental pictures or a belief, is often programmed into their subconscious mind by some emotionally distressing experience.